So PCOS is polycystic ovary syndrome. It's the primary cause of female infertility. A lot of people think that's all it is. They go through life, they don't know anything about what's going on, they try to get pregnant, they can't get pregnant, and then finally they get diagnosed with polycystic ovary syndrome. A lot of times doctors will say, okay, we're going to do all this reproductive technology stuff, we're going to get you pregnant and send you on your way. Great, only it's not so great. PCOS is also one of the primary contributing factors to type 2 diabetes, heart disease, high cholesterol, anxiety, depression, fatigue, eating disorders, and a host of other things. So what does PCOS look like? Looks like all of us potentially. Why? It's 1 in 5 women that have it. There have only been a couple studies, but in the female to male trans population, about triple that amount is showing up with PCOS traits. So really interesting stuff going on, and you've probably seen a lot in the news recently about trans issues. So it's a big health concern for a lot of people. And it's possible, according to some of the studies that I've recently been reading, that as many as 1 in 3 women has it.
Wow.
So when we talk about that, we are talking about a health epidemic. And it's a very costly epidemic because of everything that's associated with it. And so where I come in on this is that I'm a health psychologist, and I started out probably 12, 15 years ago focusing on infertility. It was something I was dealing with at the time. And I saw that the procedures for infertility were expensive, painful, inconvenient, and created 1,000,001 mood symptoms. In other words, they kind of make you feel crazy. And there was nobody dealing with it. There were literally maybe 3 therapists in Los Angeles County that I could identify who knew something about infertility issues. And then I quickly came to realize that PCOS was the root cause. And realized in talking to some dietitians that almost everyone with binge eating disorder has PCOS. And by almost everyone, I mean she found 100% correlation in several years of working at one of the primary eating disorder treatment facilities in the country. So I went through training with her and got certified as a PCOS educator, which is part of what I do now, obviously. And the psychological part of it is that when there's a hormonal imbalance, you end up with a lot of irritability and mood swings. Those are 2 big things. Like when I survey clients. Apparently that resonates. So irritability and mood swings are really huge when you're having hormonal issues. And I think some of the laughter here is probably because when you run down a symptom set for PCOS, it looks a lot like menopause. Except it's occurring starting from puberty or pre-puberty. So the deal is you're born with it, and it doesn't kick in until puberty age when all the hormones start shifting. And so it may not be teen moodiness, it may be PCOS. It's also something that if you don't treat the underlying symptoms of it, the insulin resistance which is present in most PCOS patients, the symptoms get worse and worse. And what does that look like? Well, if you think about circuses and the bearded fat lady, she was probably a PCOS. Undoubtedly a PCOS patient. Right? So there are women who have full beards, other hair in male places, so like nipple hair, happy trail hair, hair on your back, really dark, heavy black arm hair. So I see women who come in and it's summer and they are dressed like head to toe covered because they've got so much hair it's literally unmanageable, or they are shaving their entire face and bodies every day. That is devastating, really, really devastating and demoralizing. Coupled with acne, male pattern hair loss, central abdominal obesity, which is present in a lot of women, insulin resistance, depression and anxiety are also elevated. And then, of course, all of the eating disorder behavior. The #1 prescription for PCOS is lose weight. Lose weight, lose weight. Do whatever it takes. Well, guess what? That means eat less, exercise more, right? That's what we've all been told. Wrong, wrong, wrong. First of all, it leads to an eating disorder. That's how I got my eating disorder. 5 hours a day of exercise and about 800 calories a day. Definitely an eating disorder. And the real prescription is calming your body, calming your brain by not eating irritating foods and identifying your personal issues around all of these things. And so now when I tell people that what I did to lose weight was I ate twice as much and exercised half as much or less, they look at me with shock and horror, but it's true. And so, along with getting your body settled in, in that regard, it's something where it calms all the psychological symptoms. So the chief recommendations that I make are, first of all, meditation. I'm really in love with meditation, like even just 3 minutes a day, 5 minutes a day. Download the Insight app, it's free. You can customize it by time settings, whatever. Just do it. Gentle exercise, like what they do here at Kinesis is conscious movement, is what I categorize all of it as. So it's things like Pilates, yoga tune-up balls, walking, aqua jogging, swimming, weightlifting, definitely, because we definitely need the weights for a lot of reasons, and also functional training, like what Kim does here, is really important in my mind for this sort of thing. And there's a lot of mood boosting from that. You get a lot of good things going in terms of endorphins, and also it's something that gives you more confidence about your body. So one of the things that I write about in the book is how exercise actually boosts your mood from kind of the outside in, but also inside out. And additionally, diet, which is the hard thing to tackle, because most of us have been told all of our lives that we need to lose weight, and it's very popular in the PCOS community to go on highly restrictive diets. Keto is the current trend, and it's often a gateway to an eating disorder. It can be really useful for some medical conditions and for some patients, but it's not useful for everyone. We're also told to give up all grains, all dairy, all sugar. I could give you the lecture about, oh my God, if you don't control this, you're gonna get cancer and diabetes and heart disease. I forgot to mention the cancer part. When you don't have a period and you build up excess lining in your uterus, you can often end up with precancerous cells. And then you end up having dilation and curettage, DNCs, or hysterectomy. So like in my case, I share this in the book, I had 13 gynecological surgeries due to PCOS, culminating in a hysterectomy when I was 44. And that takes a huge toll on your body and your psyche as well. And so this is the kind of thing I really want women to know about to prevent that in the future. I don't want anybody to suffer the way I have suffered. And so all those things, like getting to know how to deal with your own health issues proactively, like how to choose a good healthcare team, who you really need to be on your healthcare team, those are all things I talk about in becoming a really assertive patient who does her own research, who goes out there, who questions things, who tries and experiments. Like I'm a big fan of experimenting on myself and seeing how it goes. And those are the things that I recommend. So there is no miracle cure. I know cure is in the title, right? It's right there in the title. But actually, if you did everything in the book, it does effectively serve as a cure. So that is the story of the book and how it came to be. It took me about 7.5 years to research and write, and I am so happy to have it here, and I really want to thank Dr. Sheila Foreman, who is my accountability buddy and coach. She made me get finished with it, and so did AJ, who's hiding in the corner, and Lynn Janae, who has been such a help in terms of nutritional approaches, and Kim and Dawn for having solidified a lot of my approach about movement also, and providing this place that is really respectful of all kinds of bodies and of being functionally fit and well, not being skinny or perfect. So that is the basics of what the PCOS Mood Cure is about, and I am ready to take some questions.
Can they actually see the cysts, the multi-cysts
Yeah,
on the ovaries? Is that how they can visualize it?
So what is
How
really
do you
tricky
get
about
confirmation
PCOS?
on that?
Yeah, so there's a characteristic string of pearls that they will see on that sort of procedure, but you don't have to have cysts in order to have PCOS. So this is why it's really bizarre. You have to meet 2 out of 3 criteria, which is having no periods or irregular periods, having evidence of hyperandrogenism, which would mean like the male pattern balding, the hair on your face, that sort of thing.
Would that be a pituitary thing too, or no?
They always do a rule out for pituitary tumors, yes.
Right.
And then the third thing would be the cysts, the ovarian cysts. And it's normal to have cysts in your ovaries. Everybody's got them. If you were to get rid of your ovaries, that doesn't mean you would get rid of PCOS. And you could have no cysts and still have PCOS. So there's about, at this point, half a dozen different types of PCOS.
So the criteria is all these different things.
Yeah, the criteria is really basic, but now there's skinny PCOS or lean PCOS. So you could have PCOS and not be overweight. You could have it and not have insulin resistance. You can have the classic type, which is what I have, which is where I have the excess weight, I've had the hair issues, and having like early onset type 2 diabetes and infertility. So that's like classic PCOS. But also there's what they call a male phenotype. So this is where it gets really interesting in a bigger way, which is that men can have the same metabolic dysfunctions as women, without ovaries at all, obviously. So it's a much bigger topic than just what we know it to be sort of on the surface, but for right now I'm content with presenting what we know, and the rest, you know, we'll figure out as we go along, so.
And so just to continue that, with people that have the body hair, with what you're talking about, the curate, is it anything reversed? Or is it...
Yeah, so basically to contain the symptoms, you need to get back into a stable metabolic state. So the body is always striving for homeostasis, which is kind of the underlying theory, like of naturopathy or homeopathy. And the problem is, though, when it gets out of whack, and it's too far out of whack, anything and everything you do to it just makes it get worse and worse and worse. So the idea is gentle push back towards that center line. And that will help alleviate symptoms. So also, like for the hair growth, drinking spearmint tea consistently, like for at least 3 months on a daily basis, can help limit the hair growth. Interesting.
It is interesting.
Yeah, so I'm at this point where with Western medicine, you know, it saved my life on more than one occasion, but it's also messed up my life pretty well. So the more that you can do to take care of yourself without it, I feel like the stronger you're going to be, the healthier you're going to be, you're not going to get the medication side effects. There is a medication to limit the hair growth problem, and by the way, any hair growth is a sign of an androgen excess, which is why postmenopausally or going through menopause, you might end up with some nice little chin hairs. Isn't it joyful?
I'll drink to that.
Yeah, I know, right? Linda has a question, then Stephanie.
Yeah, is PCOS pre and postmenopausal?
PCOS is lifetime. You are born with the genetic predisposition for it. It doesn't manifest until typically pre-puberty, so maybe 10 to 12 years old, and then becomes more fully symptomatic in your teens. For a lot of women, though, it doesn't seem to really appear until they get to be in their 20s, and all of a sudden they'll gain 25 or 30 pounds in a couple of months, and they'll have these wild food cravings that are just uncontrollable. They'll get depressed, anxious, moody, all of that kind of stuff. So there's some evidence, and this is a whole other thing, like have a conversation with me about my dissertation, but early unresolved childhood trauma often is the thing that sets off illness. So we've got these genetic predispositions, but it takes having acute stress in your life or your body to have the disease actually come out. And I think that that's a big factor in PCOS.
And once you had, say you've had a hysterectomy, you still have your ovaries.
Yes.
Can you still have PCOS?
Yes.
Okay.
Yes. Even if you have no ovaries, no uterus, no cervix, you still have PCOS.
What are the conversations that the medical community is having about PCOS?
That's
because
fantastic.
I'm working with a women's center and I've never heard this term until you introduced it to me.
So the conversations they should be having. So this is the interesting thing. Who actually diagnoses PCOS?
Right.
It's usually a gynecologist. So that's going to be your first stop if you're having problems trying to get pregnant, or if you are having irregular periods and you end up with some of the, like during your pap smear, you'll end up with the irregular cells showing up, and they'll say, oh, we'll watch this, or we'll put you on birth control pills. Birth control pills are the first line recommendation usually for PCOS, but they only mask the symptoms of PCOS. They don't fix anything really. So gynecologists, when they get stuck, will refer to reproductive endocrinologists or endocrinologists. reproductive endocrinologists are the people who do all the infertility treatments, so they tend to be fairly knowledgeable about PCOS. Endocrinologists in general will know about it, but there's not that many doctors that are really skilled at treating for it. My private practice here on the west side is in health psychology, and I only have maybe half a dozen people that I refer to regularly. And that's amazing and horrifying given that this is Los Angeles.
So I guess just as a quick follow-up.
Gynecologist.
Am I thinking of it as perhaps the medical community should be screening for PCOS?
Yes.
Even if you're not showing symptoms?
I really believe.
Because then when those symptoms begin to appear, you can.
Yes, because treating it early really saves lives. And here's the thing, one of my best friends from high school, she was the fat cheerleader. Like that's where it's at, you know? And always very active. And the one plus side of PCOS is that we build muscle mass more quickly and easily than other women. I'll take it, because there's not much else that's a plus. But yeah, her mother, as it turns out, died of endometrial cancer, which is much more common among women with PCOS. And she was born when her mom was like 47 or something. So if you know anybody where the history has been multiple miscarriages, or they just couldn't get pregnant, and then all of a sudden they get pregnant somewhere after 40 and have that one kid, that is almost always somebody with PCOS, because after 40, your eggs are like, wait a minute, we're about to expire. And then, man, and this is why we end up with a lot of natural twin pregnancies after the age of 40 also. So her mother also had cancer, and she was a very large woman. I'm sure she had other medical problems associated with PCOS that was never diagnosed or treated. And now my friend was diagnosed about 10 years ago. So she is doing all the things that she needs to do to take care of the PCOS, but we feel that her mother died quite prematurely, like in her 50s, because of PCOS, and that is a not uncommon story. And that is not okay, and that is why I'm on a total rant about this, because as common as PCOS is, it is not a glamorous or sexy disease, and it's not well known enough. It's difficult to identify. Doctors tend to get frustrated with it. And, you know, here's your birth control pills, here's your metformin, which reduces insulin resistance, and, you know, go on your way and leave us alone. And it's not that easy. So really it is something where you have to take care of it yourself.
But is there a definitive, test?
You would look at A1C, glycosylated hemoglobin. If that is elevated, it's an indicator of insulin resistance. And you can do the pelvic ultrasound to look for multiple cysts in the ovaries, but anything over 10 cysts in one ovary is indicative. I've had patients come in who had 40 cysts in one ovary, and a doctor who insisted that they did not have PCOS when they presented with every other sign and symptom of PCOS. And so that's kind of the battle point for me. But yeah, so those are the basic tests.
What about a woman that's 50
Yeah.
and never heard of PCOS, and maybe is there anything to do, or are the dice thrown?
Great question also. So a lot of women don't know, and that's also, I get very excited about that. Sometimes when I give professional lectures, I'll have women in their 60s come up to me and say, oh my God, thank you for putting the pieces together. I didn't know I had PCOS, and this is absolutely what I had. They went through a lot of infertility, miscarriage, other problems with their health issues. And so yes, you can have it. They can't really diagnose it necessarily perfectly 100% because you don't have the ovary activity. But if you're exhibiting all of the other signs, and you may have been told you have syndrome X or metabolic syndrome, or you may just be thinking in your head, like I have a symptom checklist in the book, you may just go, oh, check, 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 whoa, I think I maybe have this. And then it's extra important to be on top of all of your lab work, make sure that your cholesterol numbers and your sugar numbers are really contained, and that you keep doing things for stress reduction and for, I'm not so concerned about weight management, I'm really much more interested in health management. women. You can be healthy at 300 pounds and unhealthy at 100 pounds, as we all well know. And so I'm more about keeping the numbers good and doing the things that you need to do to regulate the psychological symptoms, but you can't separate mind and body. So that's why I do a lot of body-based therapies, somatic kind of therapies as well, but I really like where people have the training, like, is Liz still here?
No.
Like Liz, the massage therapist here, does a lot of like mind-body integration stuff. And it's something that Kim and Dawn bring into the work too, like what's going on historically. Dawn was walking by me one day and looked at something about the way I was holding my throat. And it was like, have you ever been intubated in a surgery? I was like, what? Kim was working with me. And I went to see her, and there was something, because I've had all these surgeries related to PCOS, there was something that was displaced in my throat, and she corrected it, and it improved a whole bunch of other symptoms. So it's kind of like, oh, this is a trip, what our bodies and our brains are doing. So, yeah. Lindsay.
Well, I just wanted to say, first of all, thank you for writing this book and spreading awareness about it, because it is so important. And PCOS really is on the rise, probably because of endocrine disruptors, as well as higher stress levels, for sure. I think, when you see somebody, thank goodness it's being identified earlier. I mean, I'm seeing women in their 20s and 30s that are being identified. I think when it comes to the healthcare community, what's just so hard is that, and why doctors just kind of tend to write women off, is that when women, especially if they haven't been diagnosed early enough, it seems like there's always something wrong. Like, you take care of something, and then there's something else, and there's something else, and there's something else, and you really start to distrust your body.
Yeah.
So, coming up with this, checklist of things that you can do so you can stop the cycle and to get as many healthcare professionals on board as possible.
Right.
So people just don't start to say, okay, well, you're just a hypochondriac.
Exactly, and that's a really relevant point. PCOS is a chronic inflammatory condition. And when you have chronic inflammation, like if you've got PCOS body, you've got PCOS brain. Inflammation in the brain leads to depression, anxiety. We have actually a much higher rate of bipolar disorder and a 7 times higher rate of suicide. For those of you who don't know, I've got 2 suicide losses in my immediate family. It is my other huge passion. I am drowning you on social media this month because it's also Suicide Prevention Awareness Month. But the fact that 7 times more women with PCOS complete suicide, horrifying, completely horrifying and unnecessary. I was just reading a post from a woman today in a PCOS group that I don't run on Facebook, and the self-loathing, the self-hatred, the desperation, the misery, and feeling like nothing can ever be changed and this is only going to get worse. She wanted to kill herself. And fortunately, 91 women jumped in and talked her out of it. But that's where this is at, and that is not okay. So this is where you get me, the political activist, the one who has 4 years old, wanting to be the president, I think. But it is something where it's confusing, it's messy, and I 100% agree with Lynn Janae that endocrine disruptors are increasing. We have thousands of chemicals in our environment that have not been studied. Another scary fact, 40% of women over 40 are hypothyroid. Something is wrong here. Not that many of us should be breaking metabolically. So that is something where I think we need to keep educating doctors. And when you're feeling sick and weak and things keep falling apart, it's really hard to be proactive and say, no, there's something wrong here and you need to do something more about it. So pain issues are another thing that increases when you have PCOS. I get a lot of people reporting fibromyalgia, chronic fatigue and brain fog are big symptoms of PCOS also. And those are the kinds of symptoms people are like, oh, it's women, they're complaining. It's 2018. No, we're not. If we're complaining, it's because there's something really wrong with us.
When a woman first gets diagnosed, what would you recommend be the first step that they take? Because I imagine it's overwhelming to be told that you have this.
Yes.
What would you recommend?
My recommendation is really to not get into a panic about it because it's a lifetime condition, and don't immediately get reactive and start taking all the prescriptions and go on some restrictive diet. Stay calm, stay focused. Read my book, of course, because I present a very well-modulated, moderate response that is gleaned from decades of personal experience and research. By the way, if you're really into that sort of thing, I have like 25 pages of research citations in the back of this.
Yeah. 300 more pages of manuscript ready to go.
Oh yeah, it's possible that I drafted 1,200 pages of this book before I got it down to a manageable amount. Yeah, I would recommend stay calm and do your research. Any other questions, or shall we party?
Well, first you have to sell another book because
Okay.
as you were talking, it just clicked into me about my best friend probably. So now I've got to send her the book.
There you go. Okay, I can do that.